Hello, everyone, and welcome to today's episode of Public Health in Real Life. Today, we have an exciting interview to mark the World Hepatitis Day 2022. The campaign for this year, the campaign theme, WHO campaign theme for this year is I Can't Wait. And we're going to learn more about the actual hepatitis, the treatment available, and the prevalence worldwide, and some of the challenges the world still faces in terms of access. So, with no further ado, let me introduce you to the guest, and to do that, let me turn it to my co-host Maimuna. A quick word before that about public health and real life. So, Public Health and Real Life is a channel dedicated to educating public about uh, public health topics on that's still currently prevalent around the world, educating um, the next generation, inspiring the next generation of public health leaders and students, as well as more importantly, to celebrate unsung heroes in the professional arena of public health. So, with that, let me turn the microphone to Dr. Maimuna here.
Thank you so much for the warm introduction and overview, Ashwin. And just a quick introduction of our guest. Dr. Toyin Asaolu is a consultant gastroenterologist and physician. She's a two-time recipient of the World Gastroenterology Organization's Training Scholarship in 2015 and 2016, the South Africa Gastroenterologists Foundation Training, and the United European Gastroenterology Week International Scholarship. She has worked both locally in Nigeria and internationally, first as a consultant gastroenterologist and lecturer at the University of Gitwe in Rwanda. She currently works as the head of endoscopy unit and consultant gastroenterologist and physician at Evercare Hospital, Lekki, Lagos. She has authored and co-authored many literatures, both locally and internationally. Um, Dr. Tori is also the founder of TMOB Internationally and International TMOB Health International Nigeria, and through her NGO foundation, she offers specialist advice to many secondary and tertiary hospitals in the country. She currently runs various educational platforms, health educational platforms on various social media platforms, including Instagram, Facebook, and YouTube, and such as her, joining us as an audience today. She's a member of the following associations: the Society of Gastroenterology and Hepatology in Nigeria, and as well as the American Society of Gastrointestinal Endoscopy, ASGE. You're welcome to the channel today, Dr. Tony.
Thank you very much, Maimuna. Thank you for having me.
So, to kick off the celebration today, I think our first question is tell us a little about hepatitis, especially to the layperson. We have different variants of hepatitis, and how can viral hepatitis be treated and totally eradicated?
Thank you very much, Maimuna. So, hepatitis means hepatic inflammation. So, in Latin, in medicine, we like using Latin for most of the organs. So, in Latin, the meaning of liver is hepatic organ. So hepatitis is inflammation of the liver, which is the hepatic organ. So when we say itis in medicine, we mean inflammation. So if it is if it's the eye, we say there's conjunctivitis. If it is the skin, you say folliculitis. So normally we say hepatitis is inflammation of the liver. So inflammation to the layman is stress, anger, right? Inflamed. So just like it is in real life where we say, oh, it got me inflamed and all that. So hepatitis is anything that puts a stress on the liver in a way that the liver responds to the inflammation, either by swelling or whatever damage that needs to be repaired. It is called it's an inflammatory process. So a lot of things can cause hepatitis. We have from organisms, which could be viruses, could be bacteria, could be parasites. We also have medications like drugs. We have alcohol. We have some food. Some people will go and eat some funny type of plants and they get inflammation of the liver. So a variety of things can cause hepatitis. However, when we say viral hepatitis, that's really what we code on, especially when we're celebrating the World Hepatitis Day. It's really coding on viral hepatitis. And this is because there's some particular viruses that really love the liver and they kind of settle down. When they get enter the body, they kind of have a predilection to attack the liver. So whatever means they enter the body, they cause common reactions of causing inflammation in the liver. So we call them hepatitis viruses. For the purpose of this presentation, we have like five, right? We have because even though they all cause viral hepatitis, they all cause inflammation, they kind of are different in a way. So we separate them by saying there is A, there is B, there is C, there is D, in order to identify their peculiarities. And there is E. We actually have more, but for general purpose, we'll just say there are five, right? And they are different. So, but the summary is that they all cause inflammation of the liver. The A and the E usually cause acute. Acute means that they last less, they don't last beyond 6 months. So somebody gets inflamed liver, it gets better in 6 months. Within 6 months, they clear it and they are okay. So that is the hepatitis A and the E, the first and the last. And they are usually acquired through fecal oral, through the mouth. When the mouth comes in contact with contaminated food, contaminated vegetables, so we can have that. While for the B, C, and D, they are in body fluid. So they are like when blood comes in contact with blood, such that you have the blood of an infected person coming in contact with somebody who did not have hepatitis and infecting that person. That is how it is. So it could be in body fluid, it could be in the blood, it could be through blood transfusions, it could be through infection, transmission through sharing of sharps, transmission through IV drug use, transmission through, you know, sexual transmission or sharing of, you go for pedicures, you go for to the salon for your hair, you can have those things coming in contact with your blood and getting you infected. So those are the B, the C, and the D. So they also have other peculiarities again, but I think it's adequate to just say that, to just know that they are body or blood products, and that they are transmitted through those means. Also is that they can also cause chronic hepatitis. They can last longer than 6 months, and that is where the problem is. Because the longer you keep having them, the more the damage, the liver is getting infected, getting over, repair and damage, and that is what can damage the liver. Thank you.
And Dr. Toyin, when we talk about like long term, not diagnosing about the hepatitis, but there is also talk that it's a silent disease, right? So, how can patients go about early diagnosis of the disease?
Thank you very much. The most important um, factor in diagnosing is actually awareness. You will not test what you're not suspecting. So, yes, if there is awareness, and that is why thank you for having me. I'm happy to be a partaker of this program in order to create awareness. A lot of people need to know, so we need to be more passionate about creating awareness about this. Many people don't know. And when you come to a developing country like Nigeria, where sometimes they are still like struggling to even eat, you now want to talk about hepatitis. So we need to create awareness. We need to come to the indigenous society. We need to speak in the language people understand and create awareness about what it is, what it can cause, and what to do. Okay. So awareness, like I said, which could be both at the grassroots and from the even to the policy decisions. Okay, at the level of the policy making. You see, the society is protected by their government. Okay, even if they don't know about it, and the government makes it through jingles, through policies, a lot of us didn't know anything when we were younger. We're vulnerable, but because the government have put in place vaccination processes that protected you against polio, even if you're not educated, you are vaccinated. And I think so. There are multidimensional aspects of managing these things. First is the awareness, which should, at the level of the government, at the level of the of the physicians and at the level even of community level, the primary healthcare information screening, getting screening processes more accessible. So it's actually a very, very multidimensional and complex approach to creating awareness. But we're doing what we can do, and this is one of it. Thank you.
Yeah, we're definitely doing what we can do. So I have a two-part question for you, Dr. Ashaolu. The first being, what are the common treatment methods that are available to treat viral hepatitis? And then the second part is, what are the risk factors for viral hepatitis? Since you said that's the focus of the World Hepatitis Day, and who are the people that are more susceptible to getting viral hepatitis?
Thank you very much. So, the treatment depends on the type of virus you get in contact with. I mentioned earlier that the hepatitis A and the hepatitis E are oral, right, through the mouth, and that they cause acute infection. So usually, by the time the person comes in contact, yes, the person is sick, has this yellow eyes, has this tiredness, which we call Malay in medicine, you know, is bringing out Coca-Cola urine. So part of it is identification, okay? Identification and taken to the hospital. Usually for those kind of viruses, what they do is more supportive because the body is going to actually get rid of the virus. But what you do in that interim is to support the treatment, is to help the body, give calorie, let the body not be in deficit of energy, let the body, just recuperate, right? So really for acute hepatitis is more of supportive treatment because there's not, so you don't need to do any viral medications. Now, if it is chronic hepatitis, so is it hepatitis B, is it hepatitis C, is it hepatitis D, right? For the B, actually, unfortunately, is not curable, but we have medications that help us. We call them the antivirals. Yes, the antivirals. We have the tenofovir and other ones. So these medications help to bring down the virus. However, it actually depends on the viral load of the individual. Majority of individuals with hepatitis B do not even need treatment in the first place. What you're doing as a physician is that you're helping them to identify the possible risk that could put their liver at increased danger. You're trying to like remove synergistic factors, like if they are taking alcohol, you're telling them, please stop taking alcohol, please stop smoking, please stop doing this, stop taking granite because of aflatoxin. We tell them this so that they minimize the risk. So actually, even though hepatitis B is not curable, in many individuals it does not need to be treated because the virus is minimal. And when you look at the risk and benefit of treatment, it's better to just monitor. Okay. However, for people that have high viral load or they have increased risk for damage to the liver or they have family history of liver cancer or liver damage, want to treat those ones. And then that's what those people I say we can use tenofovir, we can use Entecavir, you can use all these medications that help depending on other parameters. You look at their kidneys and all that and see what they can tolerate and go ahead with that. For hepatitis C, the good news is that it is now curable. So initially it wasn't curable, but within the last decade, cure has been established. So yes, we use antiviral to cure it. Okay, we can also use interferon, but in more recent times, they are because why give injection when you can give oral and when you can even eradicate it. So that's one of the advancements of hepatitis C in recent times, curative targets, right? So that's it. For D is a partial virus that it cannot exist without B. So when you take care of B, you're taking care of D. Thank you very much.
So, Dr. Toyin, so looks like A and E is more short term. There are medicines available. C also has its curable. There is medicines available, but B and D is the one that might have to be monitored based on the looking at multiple factors along the patient. But there's the major problem there with even though there are all these cures, the problem seems to be access. So this year, so I Can't Wait is the WHO campaign team on the World Hepatitis Day this year. and it highlights the need to accelerate the fight against viral hepatitis and the importance of testing and treatment for the real people who need it. So, how can hepatitis vaccine or medications be readily available? And because a lot of people, are finding it difficult to be purchased to purchase it, unlike other vaccines which are free from the government.
Thank you very much, Ashwin. So yes, you already said it. The truth is that for Africa and Nigeria in particular, we need a lot of political, political will. Okay, we need at the level of the government. That is where we need to have advocacy. We need to have people sitting and interestingly, one of my trainers is actually she actually trained me. We're in the clinic together, and but now she's sitting at the WHO as one of the regional coordinators for hepatitis. I think Memunat has met her before. So part of what she does is that she sits with government leads, okay? She sits with ministers, she sits with presidents, and they formulate because so a lot of lobbying and advocacy because even these people that are leading us are taking among from us. So they are the same people. They don't know as citizens, they will not know as leaders. So it's about information, informing them, advocating for them, so that they know that this thing, the burden of hepatitis in our environment is enormous. People are dying from complications. People don't know what is the problem. So we need to actually advocate and lobby and advocate and lobby. Yes, the goodwill of all these United Nations, all these people that have made hepatitis, HIV treatment free could also help. Okay, we can't do without it. Okay, but I want to hammer more on the ones that we can control, which is the one within our own community. How do we divide our resources so that we channel a large amount, even if not large, an appropriate amount into health prevention? How do we create policies that make it mandatory for people to get vaccinated? Like
Hmm.
saying your son will be accepted in school if you show your vaccine card containing hepatitis B or
Right.
C or the hepatitis A and B. Those are the ones that are vaccine preventable among them. Now, if we introduce it, that those are policies. So I don't need to know about hepatitis B. I just need to have a government that knows about it or has an advisor that knows about it that makes it mandatory. So I'm like, they have said we should go and do this thing, otherwise we will not get our license, our driving license. That's how the local person will interpret it. So that's at the level of the like the tertiary and the government policies. Also, primary healthcare availability, access to other hospitals, access. They don't even need to go to the hospital. Access to points of vaccination. So make it available. I think there's a lot of funding, a lot of political goodwill, and a lot of research. People need the government and the clinicians have to come together and meet at a point where the average individual benefit from these vaccines and this information. Thank you very much.
And that table must also have indigenous people and leaders too.
What do you say?
That table must have also indigenous people and their leaders also. So their
Definitely.
representation is also part
Yeah,
of it.
they are representatives here. So I was talking about hepatitis yesterday, and somebody was complaining to me just this is the second time. Sometimes last year, the same thing. Doctor, we don't have this. I'm just a clinician, and I told them, please go and vote. Go and put your constituency. Put them put them to question them, tell them we want to live long. It's not just voting for security vote or something.
Right.
How are you going to represent me at the if you're saying you're my consistent leader, what are the things killing our people? What are the things making us so like I said, there's no but the clinicians cannot stay alone. The same thing, the government individuals cannot stay alone. We need to work together as a team to be able to get the best out of all these things. But I believe that it is surmountable because I know. At least COVID is bowing out gradually. I believe that the human capacity is much, even though we might not achieve it yet. I believe that whatever the problem, it is surmountable with teamwork and with actually knowledge. Thank you.
Yeah, we can definitely sense that passion in, the work, and I understand what that feels like. So,
Thank
speaking about, like, targets, the World Health Organization has set a target to reduce the incidence of viral hepatitis by 90%. And one of the key strategies to achieve that is by preventing its spread. So, how can you prevent the spread of hepatitis? And I think this takes us back to that previous question: is what are the risk factors, and who are the people that are susceptible, and then how do you reduce the spread of viral hepatitis?
Thank you very much, Memona. So the risk factors for hepatitis actually the first risk factor is if you're staying in a place that is endemic.
Mm.
So, internationally, any country that has the prevalence of hepatitis more than 8% is termed as an endemic environment. Okay. So, for Nigeria, according to the last statistics done from a meta analysis done 2019, yeah, it put it at 9.6 thereabout percent. So that means we are actually above the endemic target. So Nigeria is endemic. And I believe many other countries in sub-Saharan Africa or the countries in developing part of Asia and all that fall in that category. So first, if you are a citizen or you're a resident in this environment, so that you are at risk first and foremost. Among the people, now, if you have contact with people that are positive more, you are an healthcare worker, you work in the health facility, you come in contact with or people that do IV drug abusers, or you share needles, you go to the salon without using your own instruments, you share needles, then you're at risk. So those are the people. Then people that are vulnerable, people that continue they are needing blood transfusion. So you have sickle cell patients that need to be transfused regularly, or you have dialysis dependent patients or people that have had dialysis that need their body fluid going through the machine and coming out. They are all at risk because at one point or the other they need other people's blood. And don't forget, these people, they will not go and bring blood from a non-endemic environment to come and give them. They will get blood from a means them. And these people, like I said, they are super endemic. They are like more than their endemic target. So yes, so those are the people that more, or people that are having, they are having they need to be given injections. People that are people on chemotherapy. So yes, or let's go to the communities where they are managing or sharing because they don't even have access to good roads to get to places where they have functional health sector. We have a lot of people now using traditional means. Somebody was joking on social media that no, with the things with the expensive things in Nigeria, he's going to start using native concussion for treatment. And these are things that make people vulnerable because this traditional birth attendants, this traditional practice, they don't know all these, don't manage these disposable needles that we all advocate. So people are going back to going back to use traditionalists. They are going back to traditional birth attendants, and these are the things that put them at risk. Thank you.
You definitely bring a highlight of we talk about social determinants of health and health equity, and the fact that even just healthcare financing can drive people back to some of the unsafe practices. So, still on this theme and topic of preventing spread, there's the concept of, mother to child transmission of viral hepatitis. So, what are some of the challenges with that, and or controversies, if you might, and what are some of the highlights or successes that have been seen from some of the campaigns to reduce the spread of from mother to child?
Thank you very much. Mother to child is actually, I'll say, it's more prevalent, in this environment compared to the developed nations. Unfortunately, but let me highlight that in among us, it's more mainly horizontal transmission, as in it's not as prevalent as mother to child in this environment. But like the Asians, yes, they have a lot of perinatal transmission. But with highlighted some of these reasons in the past. I've said that people, because of healthcare financing, are going to traditional birth attendants. Is it the birth attendant that doesn't know about hepatitis B or C that would screen the mother? No. So the child is definitely at risk. So I think in recent times, in Nigeria, as an example, is more of these financial economic problems. That's number one. So people are lured back into the traditional practices. Secondly, is that if a mother is positive for hepatitis or C, we normally screen them to know. First of all, there's this general screening for all pregnant women that is done for people that go to the hospital. And if you're positive, we test check the load. Okay, is it much? Do you need to be treated so that we reduce the risk for the child? And lastly, when the baby is born, we normally ask you to have immunoglobulin and the vaccinations immediately advised. These are the things that will help us to mitigate the risk for the child. All these things I've mentioned require financing, either in the place of health insurance that will care for the child, for the woman, or the hospital where they can even access or do viral load testing. So in Nigeria, as of today, viral load testing is still not easy. We have few centers, maybe just two or three, okay, where they can pull this with this. So we don't even have developed labs like that that helps us to screen, to test the load, to know whether how much of this risk is there. Then when we now talk about the immunoglobulin, it is very expensive. Okay, it is very expensive. So few people can afford it. And so even when we're being trained, part of what we just do is okay, we can get the immunoglobulin, but at least get the vaccination. Okay, so you're trying to you are needing to compromise on the standards in order, and this in itself is risky. You're needing to compromise on the standard of care in order to prevent, to like not make the financial burden too much. So those things are there, and these are maybe from the level of the clinician. These are the things that I'm saying that if we now look at it as a public health problem, I believe that, and the presence of gastroenterologists, hepatologists, people that even know about hepatitis, there are not many. And so when you have it like that, is when you have information, you have the right context that you do the right thing. You have people needing to, they don't have added enough doctors. They don't have enough insurance to cover their problems. They don't have enough health facilities. These problems are they are multi-level problems that when we address them at different points, then we're able to help. Your other question was about can you remind me please?
I
I missed
believe
that.
you actually addressed it already about well, maybe sort of what are some of those policies and practices that have reduced not just the overall spread of viral hepatitis but particularly mother to child transmission.
Thank you very much. So I think the first thing is screening, which I've mentioned when I'm telling. So like I said, from the angle of a clinician, I would like just say this what we do. Screening, every pregnant woman is screened for hepatitis these days now. Okay, so most people are and I think that's why the risk of hepatitis complications will be minimized in women compared to men. Because as a woman, once you're pregnant, you can't escape it. If you're positive, we might know on time. And I think that is an advantage to the woman overall, right? So screening and peradventure you are positive, we'll try to get you to, if we can afford to get a gastroenterologist or hepatologist that can advise appropriately, then we can talk about screening, checking how the load is in your body. Once the load is okay, it doesn't monitor. But if it's beyond a particular threshold, we treat you. The reason we are treating is to bring the the viral load lower, and once it's lower, so that you minimize the risk. Then at the level of the birth, we'll talk about vaccinating the child, giving ready-made immunoglobulins that will protect the child in those periods when the child's immunity is still suboptimal. So those are the things. But all these things need financing, need information, and need goodwill, political interest. Okay, interest and auditing auditing, checking again, is it working, research into how is the transmission and all that. So I think in recent times that is an advantage that we cannot undermine. However, there is still more work to be done in that area. Thank you.
And yeah, thank you for that, Doctor. And this was pretty enlightening about the various challenges surrounding hepatitis, and the different types have different types of challenges. So in the society, there is some stigma and discrimination around, and mostly that is due to maybe ignorance around patients with hepatitis. There is some association, research has shown co-infection between hepatitis B and HIV. So, can you talk a little bit about the stigma part and then its association, the scientific association with the HIV?
Okay, thank you very much. People stigmatize people out of ignorance. I think at the bottom of stigmatization is ignorance. First of all, not knowing how prevalent the disease is very prevalent among us in Nigeria. So you stigmatizing somebody that has gone to screen, you've not even screened yourself to know whether you too you're positive first. So people don't. So anybody, I tell patients that we are all positive. Take it like that. You're just lucky that your immunity fought it, right? So if you are living in an endemic situation, a community, you're not better than the other person. So ignorance is what I found as the basic thing. If you know that the pathophysiology of hepatitis infection, the importance of vaccination in preventing it, then you will know that you were just lucky. In Nigeria, the vaccine was introduced into the community in 2004. So everybody born before 2004 was at risk. So that means it was just, abacadabra that some of us were negative and some other people are positive. So you shouldn't look down on anybody. You should accept that anybody could have been. And when we know the mode of transmission, the virus is not, yes, highly contagious, it's highly virulent, it can stay long but for adults, the risk of transmission of hepatitis is minimal. Okay, because by the time I'm coming in contact with hepatitis virus, my immunity is strong, and that's why when you have adults coming in contact with hepatitis B, they are they get sick. They have the acute version, which will go away by itself because their body is fighting it. They have yellow eyes. They are very ill. So that in itself is so. And from studies, okay, I did a study recent like 5 years ago where I tried to do a lot of familial transmission of hepatitis in the community, especially about patients, relatives of people that have hepatocellular carcinoma. And you see, the prevalence among couples is very, very minimal. So in Nigeria, what we see is couples generally being discordant. A is positive, husband is negative. Wife is negative, husband is positive. And they've had sex for 50 years. So yes, and that also emphasizes the fact that sexual transmission in this part of the world is not as it's not as much as when you compare with other things like transmission through sharps or through the perinatal period. Okay, so stigmatization should be discouraged. We should educate people. We should be kind. We should support other people because it could be any one of us. And secondly, so as a couple, there's no need to break your marriage because your husband is positive or your husband wife is negative. It's just understanding and seeing how can I support. So I think a lot of like we have people living with HIV/AIDS. All these things is because they had political support. They had people singing about it. They had channels dedicated to movies about people living with HIV. So we are taught, we are conditioned to accept. I think we can do that too with the hepatitis project. We can condition the people. We can tell them anybody, and hepatitis even is the one that you don't. We have virgins that are positive. They've not had sex before and they are positive. So who needs more support? Okay, we have a lot of non-sexual transmission. People whose parents have done circumcision for in the hope of helping them, or people that they've taken to traditionalists for tribal marks or for scarification marks, positive. They need support. We need to support ourselves. So I think stigmatization can be prevented or overcome. It's already there. It's just to educate people to take them out of it. You asked the second question, which you said about Adam. Can you remind me the question again? I
Yeah,
think
the question
I'm
was,
passionate about stigmatization.
yeah, yeah,
Don't stigmatize my patients. I don't even at work, people say they say, "Oh, can they work?" I'm like, this person is going to be doing office work. You're asking about hepatitis. Something don't stigmatize that. Is it a doctor? Even doctors. There are
yeah,
procedures to allow doctors to practice, even if they are positive. So you can practice as a doctor with hepatitis B. You can even be a surgeon. You see, they are
yeah.
just follow the protocols. Talking of people that are correct, and so we it's something I'm really passionate about. Let us not stigmatize people. Let us support. Let us create awareness to help. Please ask your second question. Don't mind.
Yeah. No, no, no. It's a serious topic. Research has shown some co-infection between hepatitis B and HIV. So, just wanted to get your um, understanding of how the two viruses are connected and which one leads to the other.
Okay. Usually they are not really connected in terms of one does not lead to the other. They can both affect one another. First and foremost, for people that maybe at the point of transmission of acquisition of the infection, maybe because yes, if you are getting needle pricks, possibly you are an IV drug abuser and you know, um, you're using needles that were infected with HIV. The same risk, the same practice that put you at risk of hepatitis of HIV could actually have put you at risk of hepatitis because they are all blood blood related viruses. So I think that's the first one. Sexually, I've told you that the transmission in this environment for hepatitis B, the sexual transmission is not so much. However, it is still possible. So the person that is getting hepatitis HIV from sex could actually also get hepatitis B. However, they could actually have been transmitted at different points in time. Okay, maybe the hepatitis B was as a child, okay, which is a normal. Don't forget, it's an endemic, right? This is an endemic region. So the child was born, the parent did circumcision, or they share the same um, needles that they use for the elder ones in order to make sure that we have practices and all that. So the child might have had hepatitis B those days, but maybe as an adult now became HIV positive. So how they affect one another is that HIV has because HIV brings down the immunity. Somebody whose hepatitis B was controlled before, we've already mentioned that majority of people with hepatitis B will not need to be treated in their lifetime. They will be okay because the body is doing a good job. It's just that it's not curable. But many people, the hepatitis is like in a late time dormant. Okay, it's there, it's not going, but it's not causing any damage. However, with the introduction of HIV and the bringing out of the immunity, the person can now have a flaring, right? A flaring of their hepatitis B. Okay, so you have them that the hepatitis B that has been dormant can now become active. Unfortunately, can continue to damage the liver and cause maybe cirrhosis, maybe cause complications like cancer early. So I think that is where our yeah. And somebody that has hepatitis B and I am hepatitis B and maybe has a kidney problem from hepatitis B or has a liver problem and needed to be transfused, maybe might have, but it's not common. I think they are really the is either they got infected, the two of them were introduced into the person at the same time, or they kind of have that kind of in- risk risk of exacerbation of a dormant infection. That is what is possible. Thank you very much.
No, this is
Yeah,
this is good
yeah.
information.
That very, very, and we're actually coming towards the end of the interview. So for any live audience, please share your questions and comments in the comment section for Dr. Asaolu. As you can tell, this is something that she's really, really passionate about. So this takes me to the next question, Dr. Asaolu. What inspires your work, and how did you come into, like, hepatitis and gastroenterology?
Thank you very much. I think that I would say that um yeah, I think I'm I'm a people person. I feel I think I can be sensitive. Okay, so I think that's first and foremost. So I can be there with people, and I believe so much. Like I said, in the human capacity, I believe that we have so much to give, and we should do our part. I believe we can't do everything. I believe we can do one at a time, right? Do the one you can do and move on. And I also believe that sometimes we are made to feel things so that we can actually be solutions to those problems. So I did gastroenterology because it kind of, I think I was just like, I was just going and they're like, please help us cover our gastroenterology department for a while. When I was in training, and I saw how dynamic. So today I know hepatitis B. Tomorrow I don't know what is happening again. It's kind of dynamic. I like the fact that it makes my brain always working. I'm like, okay, what is happening? So for hepatitis, what goes for A doesn't go for B. Okay, so as a clinician, you need to keep thinking. You need to keep say, okay, what is this? So I think I got I got sucked into the intricacy of hepatitis management, and I love the fact that I I can talk to people about it. Everybody, when we want to do gastroenterology, they're like, wow, they have liver that they die. They are, and I said, no, I am here to change the narrative. I am here to prevent it, to prevent. And I think the thing, and that gives me joy. If I'm managing people, you are ahead of the problem. Before they have liver disease, before they have liver cancer, you look up for it, and you communicate to people in a way they understand, in a way that they know that there is hope. I think so many times people are afraid and like, liver, hepatitis, and because of that, they run away instead of them to run towards the health professional. They run away. So I am passionately interested in telling people that no, don't run, face it, look at the problem. What can I do to prevent it? And I would say in my practice, and I also talk about advocacy because if there is health insurance, okay, people can even have confidence. The Nigerians, we don't want to go to the hospital because you're thinking, how much would they cost? But when you make it, when the health insurance is available, you don't even bother. You go, and it is in talking to people about it. So I have an adage I tell people. I say, please come and give me a handshake and go. Don't come when they are carrying you because you're sick. Come when you are okay. And let me tell you, no problem. Just go and come back another day, which is everybody is happy. So me and my patients, we are angry, we gist, and they go. But look at the other patient that did not have information, that instead of being careful, is taking native concussion, is drinking because nobody informs them. And now comes the liver damage. I had a 35-year-old man that the first time he's knowing that he had hepatitis B is when he had cancer, and I was invited to see. He had cancer, he had three children, beautiful wife, a banker, at the peak of, the guy is just starting. And I can never take away that picture from my brain. And that is why I want to encourage people, please tell people about hepatitis. Please advocate because it is not a big deal. And stop stigmatizing people. I think that is actually what inspires me mostly. It's just to be a difference. It's just to help people understand that yes, there are problems, but the problems are not defining us. We are overcoming it because through knowledge, through political will, and through healthcare excellence.
Thank
Um,
you.
Thank you very much.
No, I definitely hear you. And you mentioned something about you have some patients that you've seen along your journey that never leaves you. And I remember one at the University of Ilorin Teaching Hospital. She was probably in about her 30s and was diagnosed with primary liver cell carcinoma and happened to be hepatitis B positive. So yes, that stays with you. So I'm very glad for what you do, not just as a clinician, but then also as the founder of Team Up Health International. So, like Ashwin said previously, the theme for this year is I Can't Wait. And then also talks about bringing hepatitis care closer to you, and in this case, you being the community. So, what advice do you have for all of us and our audience with regards bringing hepatitis care closer to the community and, getting to that target of not just 90%, but, reducing it by 100% if possible?
Thank you very much. I think the word closer means identifying with the people. So the way I'm going to reach the Generation Z is different from the way I'm going to reach the 60s and above, the boomers, okay, the baby boomers and all that. But so I think it's about identifying the target. So in this generation now, we talk about social media, Instagram, you know, I talk to the 30-year-olds. They say, "Oh, I don't have a Facebook." So yes, Facebook I think is for some of us and our parents. I think so. Instagram, TikTok, can't we create a challenge on hepatitis? You see people now, everybody trending on a particular challenge, new challenge, water bucket challenge. You see, create challenges that tell people about hepatitis.
Mm.
People will trend because they want to trend. But I think in trending, to the people that have this social media, you have passed the message. Check yourself. Support somebody that is positive. That's number one. And I now think at the grassroots, we have other ways like health door to door, community health extension workers, family health. If these people are equipped with, like I don't think the World Hepatitis Day should be just one day. I think for even though if WHO is making it one day, every country should make it like a week or twice a year, where they are just focused on hepatitis B, hepatitis C, hepatitis D, hepatitis A. Just 1 week of activity where
Mm.
you do one. It's like we're doing your normal censoring, and you're telling people, "Have you been screened? Okay, let's screen you." You see, this is can only be achieved when people are passionate about it. Hepatitis is one of the. I know there are many other problems, okay, but if we face one problem one at a time, we're able to, bring down the mortality associated with this problem. Thank you. So I can be reached on Instagram. I'm Dr. Toyin Asaolu. DHTOYINASAOLU. I'm not doing so much because I'm not a professional in Instagram. I'm a busy person trying to juggle. But like I said, I think it's born out of the passion to just like inform people, like just like you have this information, you know these things, and you when you die, you won't use it anywhere you go. So you can only use your information when you are here. So I think that's why I try to just give back and talk to people about it. So yes, Dr. Tonya Shalu, I inform people on that. Then also there's a hepatitis corner on Instagram. I have TikTok, I don't use it very well. I have Facebook, I'm Toya Shaul. So I'm trying to but yes, a lot of people can 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 reach people by speaking in their language. I think that's the summary. Thank you.
Dr. Toyn, that was pretty inspiring. The work you do. I have one question that is outside of hepatitis now. So you are a doctor, you're a researcher, you are a patient advocate. You go and talk to multiple stakeholders. You've started your own patient advocacy group. What is your message or advice to young girls and boys who want to tackle some of these world challenges?
Mm.
Um, what is just your leadership or uh, career development message to young professionals, students and professionals?
Thank you very much. I think that first is that people should identify what they are passionate about. Is there a problem that is not making you sleep? I think first of all, people should look beyond themselves. People should sometimes because we are overwhelmed with technology, social media, we're kind of me. But the truth is that I recently learned that we're not meant to be perfect. We're not meant to be complete before we are functional. I think that we are all part of a puzzle. Of the world as a project is a big puzzle. And puzzles are not the same shape. Some will be like this, some will be like stars. But at the end of the day, when you put these pieces together, you have a beautiful picture of what the puzzle is supposed to be. So everybody has a part to play. So yes, you that you're looking at me, you're not perfect, but you have something that makes you, agitated. You have a solution you want to create. Can you face it? Can you do that part? Don't worry about whether other people are doing their own. You do yours and move on. I was in the plane 3 days ago and I was sitting above the sky and I was feeling like holding those clouds. And I was like, where are the right borders? They are nowhere. But here am I enjoying their invention
Mm,
while they are long gone.
mm,
So they've done their part. We are all enjoying it today. So we are all meant. Look at people that have developed antibiotics before gonorrhea was killing everybody. Everybody does their part and leave. It doesn't guarantee that everything will be well ordered. So we all have things to do. So identify your challenge. What is around you? Identify how you can be of help. You have something to give. Give it and go. I think that's what I want to say. Thank you.
Thank you so much, Dr. Ashaolu. On that note, I there's nothing else to say after that very poignant message you just shared. We just want to thank you for joining us on Public Health in Real Life as we've celebrated World Hepatitis Day. Thank you for sharing your insights, not just on viral hepatitis, but on the different modes of, reducing transmission, spread, causes, treatment, and sharing your passion. Really, is we have a comment from one of our viewers who says, "Thank you so much, Dr. Olutoyin, for simplifying the topic hepatitis." And I like when you said you have to send the message to people in the way they would understand. So we look forward to having you one day again on the channel. And for our audience, please like and subscribe our channel. Please send feedback on questions and topics you would like to see us address. Thank you all so much for joining us today. Be safe, be well, and please be advocates for hepatitis. Reach out to Dr. Toyin Asaolu for any questions you have, and see you all soon another time. Bye.
Bye. Thank you for having me. Thank you, Ashwin. Thank you, Memina. Bye bye.